is the experience that the patient is experiencing in VR different for the acute and for the chronic? I mean, I would assume it's some sort of distraction in the acute scenario. Are the experiences significantly different? Do the experiences matter? And also kind of like, what are the experiences themselves? Are they just kind of in a field? Are they in some sort of natural space? What exactly is the patient going through?
Right. So we've done a number of applications. One is called Cool. It is a journey through a kind of a landscape. You're playing paintball with otters, so you are interacting with these animals in the world. You're going through caves, and there are crystals, and it's kind of like a playground.
Okay.
It's pretty open-ended, because if you're going through a wound care situation, you could be in there for an hour, or you could be in there for 5 minutes. We don't want to give you a score necessarily, so it has some differences from a conventional sort of game. The elements are designed to be very engaging at a number of levels. So if you want to interact, you can interact. If you want to just watch the snow fall or the cherry blossoms blow around, then you can do that. It's kind of it's designed for multiple uses in a clinic. So unlike a game, which is driven, conventional games are usually driven by hyping you up. And also, you die.
Right.
You die, you fail, and then you go back and try again. Well, that doesn't really work in a wound care situation. You need to be going through the whole thing. So there's a lot of ways that's constructed, the way the environment's put together, that are really designed to meet the clinical needs. We do a lot of things with trying to, reduce any kind of sim sickness, or we don't have people getting sick. It's a great environment for that. So that's used for acute and chronic pain. So your question was sort of about, the applications and using things, different kinds of things. So pain is complex. We are complex animals, right? And if you have a chronic condition, you may have acute flare-ups, like I feel really crappy today and I need to get through something, or I'm at work and I just need to be able to function for a meeting. So there are short-term and long-term things. So something like, so our application Glow that we created uses biofeedback. You are it's a hand interface. So we're using a hand tracker. So you see your actual hands in the world, and you're playing with fireflies. So there are, you're in a kind of a calm evening place. There are fireflies flying around. You have a heart rate sensor. And when you lower your heart rate, your hands become attractors to these fireflies. And so then you can start playing with them, and you can kind of move them in and out, and they become kind of this living organism. We also have lanterns that come out of a pool. They're shaped like animals. And then you can share your light with the lanterns, and they go flying off. So there's a way that you can kind of use it as, you can use it as physical therapy. Patients in a bed can still do this. It's not completely, it's not, it doesn't require them to do anything specific. So like they can be just very calm and meditative and mindful and just sit with the fireflies like this.
Right.
Or if they're more capable and, physically able, say post-surgery, where sometimes they don't want the patients moving around, they can be either calm or they can be more interactive. It's kind of it's an open-ended experience, but it's driven by the biofeedback, which creates a closed loop So you start becoming aware of your own internal state.
Very
So that's one way. That's more towards the chronic pain. The cool application I described is more towards the acute kind of situation, but they can be applicable in lots of different environments.
Yeah.
So that's sort of the way it breaks down.
Okay, interesting. And so what would be kind of like the reduction amount that, I mean, it might be a bit difficult to put it into percentages, or maybe like a point system would be better. Is there like a substantial?
We've done tons of studies. There's lots of, if you look at firsthand.com, we have a lot of clinical studies that are published. So yes, it's been very much quantified. So an interesting thing to note is that a dose, so drugs are dosed, right? So a dose of opioids is considered to be a 30% reduction in pain. Okay. So that's one dose. And VR is doing that, twice that, sometimes 100%, sometimes, really? It's a very personal thing. It all depends on, it depends on who you are, your perception of pain, what you're doing, how bad the pain is. So it's not, it's not a one-to-one, but the effects are far exceeding a level of, a dose of opioids.
Yeah.
So, and that's very consistent over many types of conditions and treatments and people, and it's been done for years and years. So the stuff works.